Okay, so welcome. This is our third Valley Hills General Meeting. A couple of housekeeping items. Patrice has indicated that she would prefer to answer questions at the end. So as questions occur to you, you can go ahead and write them in the chat. If you're not familiar with that function, if you hover, depending what device you're on, but probably if you hover either at the bottom or the top of your screen, the same place where you found the mute and the stop video, there should be a chat function, and that will open up the chat window that will allow you to both put questions in there, also to see what everyone else is asking. And when Patrice is done, she'll go through that chat. And then if it's not convenient or you'd rather just ask in person, after those questions have been answered that are in the chat, then you can unmute yourself and go for it, okay?
When we do the chat, should we do it to send chat to everyone or just to Patrice?
I would send it to everyone.
To everyone, okay.
Yeah, yeah.
Patrice can't be trusted.
Yeah.
Wait,
Unless
you already
it's
know
a
the
secret
truth?
question. Okay, I'm going to turn it over to our president to introduce.
That is not me. I did not do that.
No, that's
What you have for
Pippi.
dinner?
Wait a minute, we're gonna mute.
I'm going to mute all, Nancy, then you can unmute yourself. Yeah.
Now you got Roma going. Am I non-muted?
Yep. You are.
Okay. So, see, you got Roma going. So, I am very happy that we have Patrice here. I found Patrice, someone recommended her after I was talking about how I really wanted Roma to have massages regularly during her agility career. And I said, but nobody's been able to contain her, and it's a waste of my money because she just spins out of control, and they go, okay, we're good. And so I took Roma to Patrice, and within 3 minutes on the first time, she was lying down, like if anybody saw that picture, she was just totally relaxed. And it was amazing to me, and I can really see that she relaxes and gets a lot out of it. And then this week, I actually took myself to see Patrice, and I think I was pretty well behaved, right, Patrice? Mm-hmm. And yeah, so I had my shoulders worked on. So I just think that what she does is magic, and she's going to tell you all about it. Cranial, sacral. If I had a horse, I'd take him too. So Patrice, if you want to go.
Thank you, Nancy. Hi, everybody. My name is Patrice Gale, and I am a holistic therapeutic body worker and massage professional. I've been in practice since 1994, and I live in Chatsworth and Houston, Texas, though COVID has changed a lot of things recently, and I'm not going back to Houston. I usually go back every 6 weeks, but not this year, so I'm staying put. And I thought I'd tell you a little bit about myself so that you had a little understanding of my experience. And when I first started training dogs, I was about 13 years old. That's the first time I was paid by somebody to train a dog. They were very impressed with the manners that my dogs had. And so I started training and enjoyed it immensely. And I also found that I was more comfortable working with animals than I was with people, what teenager often isn't. And so the privilege came when I was about 16, and I got to work at the Cleveland Natural History Museum in Cleveland, Ohio, with the curator of live animals. And I was a primary caregiver for birds of prey, and then lots of local mammals and other natives. And I worked there from 1970 to 71. That makes me very old. I had the privilege of taking animals to my house because one of the primary goals that we had was to acclimatize the animals to people so that they could go to various and sundry facilities or lecture halls and introduce people to the various animals so that we could start working on conservation even back in the 70s. The following summer, I worked at a red feather agency in northeastern Ohio, and I was a caregiver for a diverse range of animals. Hold on one second. Pardon me, sorry. And I worked with cougars, with a variety of different monkeys, worked with a number of birds of prey, and then lots of indigenous animals to the Allegheny Mountains, raccoons, red foxes, possums, and then we had a variety of exotics as well. I was privileged to study with some really amazing obedience handlers when I was in the mid 70s to early to mid 70s, and I had a Cocker Spaniel that got Dog World in both America and Canada on her CD, and that was my first obedience dog. And everyone was sort of stunned because Cockers back then didn't do obedience, and nobody got that kind of stuff. So that was exciting. Moved to Houston, Texas, and worked at the pet shop and bird clinic. I've never seen a pet shop like this before. It was the 70s, the mid to late 70s. There were thousands of birds, and we had so many different types of parrots, macaws, cockatoos, and we were constantly manning them to keep them tame because most of them were not, unfortunately, hand-fed. We also had lories and lorikeets and mynah birds. We had jaguars. We had, do you get the idea? The Prince of Saudi, one of the princesses, would come over on her 747, and they'd drop $10,000 and buy a bunch of exotics, and they'd stay in Houston for 5 to 6 months, and various of us employees would go over and clean the cages and take care of the animals because, their people were too good to do that. So it was fine. I got lots of wonderful experience working with just a multitude, and really discovered how much I enjoyed and loved the citizens, the parrots. I got to tame, train, and hand feed. I had the privilege of hand feeding a number of parrot babies, and that was really amazing. And then the following year, I ended up running a smaller pet shop, and we had hyacinth macaw. We had all sorts of exotics that lived at the shop that weren't for sale. And we also had a number of dogs that lived at the shop, and so I had the privilege of working with them and making sure that their lives had good value and good quality. I got to play with snakes and other exotics and decided that that was just not something I really enjoyed. And from about 1983 to 1996, when I started winding down, I worked with a very dear woman who had trained obedience in Chicago and had moved to Houston to become their in-house dog trainer for the police department. And of course, as soon as she got there, they had changed police chiefs, and they changed their opinion. And so she went to work somewhere else, but started doing dog training in the evenings. And I joined her, and we had an incredible time, taught hundreds upon hundreds of different dogs and different breeds. Worked for a short time for Petco, was not impressed, and then discovered agility. And I had the privilege of training with Jane Simmons Moak, who is the queen of distance. And she's one of the foundational people of agility. They were training in the late 80s. And she helped Kenneth Tosh create the USDAA, in that they were part of that foundational group of people. She's a world team member, an AKC judge, a USDAA judge. She won the invitationals. It was really pretty exceptional, and training with her was an amazing experience, and I did that for 11 years. Then I moved here to LA, and thanks to wonderful trainers here as well, and I'll give my hats off to Barbara Ma, who's been my major trainer. I mocked my toy fox terrier, who was a rescue, and we went to the invitationals 4 years in a row. I thought that was pretty impressive. I now have a smooth fox terrier, and she has been invited to the invitationals twice, and just got invited this year and has gone once. And she's my little moth girl. She's just delightful. 1994, I became a licensed massage professional, as well as a health professional practitioner. And those were things I've been doing a lot in my lifetime. In 1996, I started bringing massage chairs to dog shows and working on people. And then we started working on dogs as well. It was the first. Nobody was working on dogs. And everybody kept being told if they worked on a dog, they were going to lose their human license. There was not a PT alive who would touch a dog. None of the vets were working on dogs. It was a very strange time. And I really stepped up as much as I could because I saw how much difference it made in the quality of the animals' lives. I've trained, I've worked with 3 different chiropractors. 2 of them are here. Eileen Hayworth and I have had the privilege of working together for a short time. I sent her clients. She sent me clients. Dr. Susan Meisinger, I've worked with her. And then one of the women who was the past president of the ASC, American Chiropractic Veterinarian Association, Dr. Jackie Duvall, I've worked with her. And then in 2015, I met Dr. Sandy Howlett out of Canada. She's a DC, and she's one of the premier animal therapeutic people. She's all over the world. She gives classes in a variety of different techniques, but primarily cranial sacral therapy in Australia, in Europe. She's been to Finland. She's worked with a number of the One Mind people in Finland. And she's been my instructor for the last 5 years, and I've become her teaching assistant. And since 1996, since 2015, I just, wherever she's having a class on small animals, I go after her and help work, and it's been wonderful. I've been in a number of different cities and states around the country offering this, just haven't gone overseas. So what does that have to do with what I offer? Well, in 1999, I studied something called craniosacral therapy, which is an osteopathic technique for non-osteopaths. And it was taught by the premier and invented in its modern format by Dr. John Upledger. And I had the privilege of taking a few classes with him, and I study under him, and he is world renowned. I studied lymphatic drainage, myofascial release, and anatomy trains. And the reason I'm telling you all of this is I want you guys to know that this isn't a fly-by-night or I just came up with this one day, but I've put in thousands of hours in study, in practice, in classroom work. And it has made a really big difference. As a traditional massage therapist, I could go so far. What I discovered with Cranial was that it got that next link because we could go to a cellular level. We could make metabolic changes in the nervous system, in the brain, which is, of course, part of the nervous system, in the digestive system, in all 12 of the body systems, we could see changes, and we could make those things by using craniosacral therapy. It is a very delicate touch. And there is a really big difference between bipeds, which are people, 2-footers, and quadrupeds, which are our dogs, our horses, our cats. And they really have a very different way of moving. So in my work, I offer massage, passive stretching, myofascial release, lymphatic drainage, acupressure, essential oils, herbal treatments, and craniosacral therapy. And I blend the different modalities, the different techniques to help meet whatever need the client has. And I call myself Hands That Heal 3 H's. And that's for humans, hounds, and horses, because those are the primary beings that I work with. Craniosacral therapy, what is it? It's a non-invasive, gentle, therapeutic manual therapy which allows me, the practitioner, to blend and meld with the client's body, finding spots of tension, trauma, and imbalance, and then helping the body release those restrictions and find peace and begin to heal itself. So I'm not doing the healing. I'm facilitating your animal in healing itself, or if you're the client, the person. And our bodies are in a state of organized dysfunction. And as a therapist, I interrupt this pattern and I help reorganize it into a more balanced place so that it is able to work on healing and be more functional. Yes, I have notes. In doing this, there are many components that can release, relax, unwind, untwist, and start to heal. And it has a profound effect on both the mind and the body, as you could hear from what Nancy shared about Roma. The work has a metabolic reset, and so it not only helps with the soft tissue, but it goes into tendons, ligaments, fascia, nerves, arteries, veins, lymphatic, and even bone. We've seen changes in bone. I know of a therapist who worked on skin cancer and over a period of time actually made a very big difference in dealing with that. I like to tell people that watching a craniosacral therapy treatment is pretty much like watching grass grow. From the outside, it doesn't look like very much, just a gentle holding of the body, but there's so much happening under a therapist's hands. It's amazing. Again, I blend and meld with my client's body, and that allows me to surf to the areas of tension, restriction, congestion, and trauma. And that can allow the client to then release in those areas. So you can see, you get to see the signs of release in a dog by things like yawning, licking of their lips, nose running, drooling, eye softening, relaxing of the body. It's really pretty amazing to watch a dog start off all stressed and frantic, and then within a very short period of time, unwind, calm down, and really relax. A thing I like to remind people that if you have a high drive animal, and a lot of us do because we do agility and or obedience, or we got into this because we have a real pushy dog, when they start getting tight, tense, or they start to hurt a little bit, or they're just in discomfort, they wind up even higher. I bet a bunch of you have noticed your high drive dogs just start winding higher and higher, and that's when they're telling you that they're in distress and they need some kind of release. And Cranial is just amazing for helping their system reset. In all of us, we have two different systems in our nervous system. One is called the sympathetic, the other is the parasympathetic. Easiest way, sympathetic. That is your fight, flight, or freeze. So we have dogs who they get into a scary situation, they don't move. We have dogs who get in a scary situation and they're gone. Now you're chasing them for hours. And then we have dogs who get in a scary situation and they attack. That's stuck in the sympathetic system. We want them to come to the parasympathetic system, which is the rest and digest. So they can actually unwind and be calm and not make you want to go, I got to walk you again? I've got to throw the ball for the next 20 minutes again? Could you please settle down? So we want a nice balance. And in our culture, we don't have a lot of balance with the sympathetic parasympathetic system. We tend to live in the sympathetic. So craniosacral therapy is really, really helpful in bringing everybody into the parasympathetic system and bringing that up, helping calm down. It's not long-term. It's definitely a period of time, but some animals actually learn to like it and can find and regulate themselves a little bit more frequently because they find that that's a more comforting place to be. There are so many positive things that craniosacral can affect. It can affect dogs with trauma like injuries, surgeries, for instance, cruciate ligament tears, OCD. We can really do a lot of helping the body restore itself. Dogs with illnesses like intervertebral disc disease, dysplasia, panostesis, which is bone disease or bone proliferations. Again, there's a lot of stress going on. We can help the body find a new normal. And if the bone's growing too fast, we can help the body calm down that growth rate. We can help it reset. Syringomyelia, you can't fix things that are structural, that are genetic, but you can certainly help manage it better. And that's a really great thing. Osteoarthritis can be helped, osteosarcoma, wobbler syndrome, wonderful, wonderful things that we've seen happen, as well as hydrocephalic dogs, amazing. If a dog has a postural issue and not a structural issue, that can really be helped. If they have a really bad top line because they're roached, because they're a little tight, or they've got a pulled muscle, or they're overbalanced, or they're not physically balanced on either side, then they will end up with bad posture. And we can really help calm that down and help their bodies balance out. You see it if their front end doesn't have good reach, they're foreshortened. and you can see that, or one leg is, or in the rear that they have a very short extension. They're not kicking their back legs out very far. Their rear legs are tucked under or rolled under their pelvis. Those are often can be improved, and it depends. If it's strictly postural, they can really be improved massively. Sloppy sits can really be changed in a lot of dogs. Pain when they start to stand up or sit down. Also laryngeal paralysis, swallowing, choking issues. A lot of older dogs end up with laryngeal problems. And we've seen some amazing results with that. And if you have non-specific lameness or specific lameness, and then if your dog's in pain, surprise, surprise, there's often a lot of emotional issues involved. And we've seen really big changes in dogs that have rage, anger, fear, uncertainty, desire to isolate, withdraw. We've seen balance come back, because when they are physically balanced and then they're having their nervous system is calming down and their endocrine system, which is all the hormones, starts to balance out, they don't have to stay in that place that they were stuck in. And it's really beautiful. So I guess I want to give you some anecdotal ideas that you can think about. I was invited at a conformation show to work on a Weimaraner who nobody was looking at in the ring. He was in a 3-week cluster, every weekend, like 3 to 4 days. They were in a different part of Arkansas, northern Texas, southern Texas, Louisiana. They were just going through this whole thing, and nobody was looking at this boy, and he had terrible rear end posture, really roached back. And I got to work on him for about 10 minutes, and he relaxed enough that when he went into the ring a few minutes later, the judges looked at him and actually were considering him and gave him a reserve. And that was pretty exciting, because we hadn't seen that with him. Same thing that I got the privilege of working on an Aussie and really saw some amazing changes in his reach. He was really short, strided in his front, and we got to release his shoulders, and all of a sudden he was flowing really nicely, and he started winning and started beating a lot of dogs. If you know dogs that have Chiari malformation or a syringomyelia, this is the brain doesn't really fit in the skull, and it tries to slip through the hole in the back of the skull, and it's incredibly painful. A lot of cavaliers have had this, and I've worked with dogs with that, and again, just giving them respite so that while we can't fix it, it's a genetic flaw, it's there, we can certainly help manage its discomfort. And if they have surgery, then we can help with the scar tissue and the healing process and make a big difference on that, so they can move better, happier. It's just incredible. I worked on a poodle that had been overtrained and was so jammed from working so hard physically that when he came down the dog walk, he got stuck halfway and would just stand there. And so helping him relax and unwind was just an amazing thing to see the change. He was able to compete. A lot of flyball dogs get really broken because they're always running and twisting when they hit that box and turn back the same way every time. And so to be able to take the twist in their bodies out of that repetitive injury strain. We've seen that also with dock diving dogs. And so there's sort of an endless availability on what's going on with your dog and what we can help it do. I offer 2 realities, usually a 30-minute session or an hour session. It depends on the dog, and it depends on how much it can handle. If it's a pet or an older dog, it tends to be 30 minutes. That's a lot of time. If it's a really geriatric dog, we may only do a 15-minute session, because that's a lot for it to take in and to process and to release. Most of the agility dogs do really well with an hour. Their nervous system is more developed and their needs are a little bit different. We've had excellent success helping epileptic dogs. I can tell you that I've worked on a number of geriatrics. I had a client bring me her dog, and she couldn't come, so her sister brought it. Her sister didn't believe in anything that I was doing and told me up front. And when the dog came in, she was 15, she dragged her feet, and she was very roach-backed and uncomfortable. And when she left, she had a nice little hippity-hop to her step, and she was moving much, much freer and clearer, and her sister just kept looking at me going, I wouldn't have believed it if I didn't see it. This is amazing. And so I give the credit where credit is due to the work that was created by Dr. Sandy Howlett and Dr. John Upledger for the craniosacral, because I'm just a happy practitioner. They're the people who put it together. But it is an amazing experience. I do not work at dog shows because this work is so deep that it's not something you want to go to. I don't know if any of you guys have ever had a massage, but the last thing I would want to do is after getting a massage is to go run the marathon or go, paddle my canoe. I want to go to sleep. I want to rest. I want to unwind. And I want my body to go ahead and find its balance. And that's very much what I say with the dogs. When people are bringing me their animals, we talk about, should they be showing, or do they need to take a little bit of time to allow the animal to balance? I know we talk very seriously about that with the horse people, because some of these changes, they go back and they're lame for a little bit while they're finding their new normal. And we really don't want them to hurt themselves. And a lot of times when you get body work, you feel so good, you can push yourself a little further. And instead of having that caution there, you can go in, and we don't want you to tear a tendon. We don't want you to rupture a ligament. So it's always best to get the work done after a hard weekend instead of immediately before. And I'm never really fond of it during, unless your dog gets regular treatments, and then it's just getting a warm up and a tune up. It's not getting worked on. There's a really big difference between that. I've had the privilege of working with Carl Lewis, the Olympic track and field star who won 5 gold medals. And he got a lot of massages during an event, but he was real clear that he never would have done it if he was cold. He really had to be in top shape and be worked a lot before he was willing to get all the work done on him, because it's just too much on the body system. So I'm kind of run out of ideas to tell you. I've babbled for quite a while. And so I guess I'd like to open it up to questions, if that's okay with everybody.
Yeah, I think that would be great. No one has written anything in the chat, so I'm assuming they're saving their questions to ask you verbally. So
Okay.
go ahead, if unmute yourself if you want to ask Patrice a question.
Me unmute. I know I have a question. So my reason for doing it with Roma, and I want to get Ouija there too, but is to prolong her showing life. And so you are saying that this is something that, over time, it's more like it's not like a one-time thing. It's something that I need to do every, I don't know, 3 weeks or whatever, whenever I can get in there. But what are the benefits of that for an agility dog like a Roma?
That's a really good question. Think about a rubber band. When you get a rubber band, it's new, it's fresh, it's got really good stretch. And the longer you put stress under it, the longer it begins, the more it begins to lose its spring and its stretch. And at some point, it gets so stretched out or twisted that it snaps. We work our dogs really, really hard. And the 3 biggest issues I have in agility, besides that it's repetitious training, is you've got weave poles, which are all about the back of the rib cage, really hard on their system. Any of the dogs who do weave poles with any speed, you can see that they are flipping their back legs back and forth and back and forth. And so it's all coming from the back of the rib cage, from the loins, from their pelvis. So that puts an incredible strain on them. Backsides are a nightmare to most dogs unless they're really long backed. And of course, the lovely A-frame, which tears up a lot of dogs. So the more that we practice and the more that they train, the more we're jamming those muscles and those tissues and those bones again and again and again. And craniosacral therapy allows the body to flush out the jam. It allows it to increase the healing, speed up the cellular changes, and soften the tissue. So instead of that rubber band getting tighter and tighter and tighter and tighter, you begin to allow it to unwind so it has a longer life expectancy. Does that make sense?
Yeah. So we have a question in the chat. I'll go
Yeah.
ahead and say. Liz Patterson has asked about how do you treat surgical scar tissue and what she could expect from a treatment for scar tissue.
Well, with scar tissue, it's a very interesting reality with scar tissue. A lot of times when the scars form, they will pucker, and it can be very red at the site. And the first level of scar tissue is inflexible and very, very taut. And then over time, that is that is broken up, and a new level, which has more spring and more bounce to it, more pliability, is then laid down. So we'll do lymphatic work with that, which helps drain any of the fluid, so the puckering goes away, and the scar can be just smooth again. And then the body can lay down a more flexible collagen so that it has more spring to it instead of it being twisted. It's pretty amazing. I've had the privilege of working a few people who had open heart surgery, and the scar was all gnarly and red and twisted, and in 20 minutes the whole scar had turned pink, almost normal skin color, and there was no more puckering. So those things can really make a difference on a dog on scar tissue, especially where the tissue is really impeding the animal's movement.
And Liz had a question from the same person, so I'm assuming, and Liz, you can correct me if I'm wrong, I'm assuming it has to do still with the scar tissue issue. How many treatments to see permanent results?
Well, every treatment has, on scar tissue, every treatment will have a permanent result. And each animal is completely different. But this is my goal. This is what I want. I want to become somebody who will just help you occasionally do maintenance. I'm not out to have you show up every week for 16 weeks in a row, 3 times a week. I see a big change in 2 to 3 sessions. We see a very nice change. But in scar tissue, I wouldn't say that it would be much more than that typically.
Great. Sue asked, are you massaging just the head or the entire body?
That's a really good question. Craniosacral therapy incorporates the entire body. If you have from the cranium, which is the top of your head, to the sacrum, which is in between your pelvic bones, and everything that connects in between, that affects every system. So it is a gentle holding technique. You'll see me holding the animal in a variety of different locations, listening to what the body has to tell me where there's tension and trauma, and helping the body release. So it is, every square inch of that body is mine to play with.
Cool. Okay. Kathy, I'm not sure if you want to continue. She started a question, when our dogs are competing, ... So I'll let her add to that in the chat.
Sure.
Or ask herself. But let me jump then to a full question. David has asked, are there any methods we can learn for our own dogs?
I can teach and am willing to do good stretching techniques and excellent traditional massage. Absolutely. And I have held seminars before, and a lot of times when my clients come, I will sit down with them and show them how I want them to stretch the animal, making sure they understand how not to put pressure on joints and what they're looking to feel and how it helps. So yes, I can either do it as a seminar for people, but my clients can always say, can you help me with this? And I'm always there to show you how to do things so that you can continue to improve the quality of your animal as well.
Nice. Okay. We have a question from Diane. She has a 13-and-a-half-year-old Havanese with a mild collapsing trachea, which is a common problem for older Havanese. Is that a condition that you can help?
Yep. That's the paralysis of the laryngeal area, and it's absolutely amazing at what we can do to help that relax all of those muscles and help the nerves release so that they're not in as bad a state. Can't make a promise that it'll be perfect, but can always work towards improvement. And I've had a lot of success with the geriatric animals and the variety of things, including that.
Okay. All right. A question from Kathy. She says, when our dogs are competing, and she has German Shepherds, nice German Shepherd, is there any, she didn't say that, I said that. Is there any massage to help them during and or after we can do to make them feel better?
Yes. Yes, there's definitely a variety of different warm up and cool down massages that you do that just keep the blood flow, get everything stretched, and as well as really good stretching before and after each run, so that your dog's at its optimal health. And that also helps you understand when something goes tight. One of the things that I really stress with people is if you don't take your dog out of the crate and warm them up and stretch them, then how do you know if there's an issue until it's become an issue? So yeah, I love to have people work their dogs before they show them so that they really do know what's going on in the dog's body. And yes, we can work with that and do.
Great. Question from Sue. She says, my 1-year-old golden male will chase water from the hose and jump in the air like a Lipizzan horse and flip himself completely around in the air. Is that okay for the dog?
Actually, a couple of times, yes. Consistently, no. A couple of things to think about is your 1-year-old golden, its growth plates have not solidified yet. And if you let him play like that for 20 minutes, 10 minutes, whatever he's willing to do, the chances of him jamming or tweaking because his ligaments aren't as tight as they should be, it's a little too high. So I really do recommend just a couple of times because it's entertaining, but not consistently. I have a smooth box terrier, and if you know anything about smoothies, they have terrible shoulders, so they like to spring up and twist and kill water hoses. And I only allow her a few times because it's just dangerous. You know, a few times to laugh, and we both think it's great fun, and then we find something that's a little bit safer and a little bit lower.
You also go through a lot of hoses that way.
That's true too.
Okay. I'm looking, I don't see anything in the chat yet. We'll see if somebody's typing, or if somebody wants to unmute themselves, go ahead.
What is it that you do post-surgery for a lot of these? Can you hear me?
Yeah,
For a
it
lot of
depends
these
on what.
dogs. I know somebody who's working on her, you're working on her dog after, oh wait, what is it? OAC?
OCD?
OCD. Not
OCD?
She doesn't need work. OCD.
Okay.
And is that all the cranial work that you're doing?
It's a combination. It really, the animals let me know. I do blend and meld a lot of different techniques, but when you have a surgical site, okay, so you've had scar tissue created, you've cut through muscle, fascia, probably tendons, all the lymphatics, so you have a whole lot of systems that are kind of messed up, and I work with the different systems of the body to help it begin to find a better way to work. Sometimes it has to go around and it'll never be able to go through, depending on the type of surgery. My example for that is cancer when I work with humans. Sometimes they remove so much tissue, and we just have to help the body find a new way to move the energy and the blood flow and the lymphatic flow. It like to go straight down. Now it has to do a little bit of zig instead of a big zig. And so, yeah, we do a lot of that. We help the body find more balance because surgery is incredibly traumatic. And of course, there's all sorts of drugs involved. So sometimes we can help the body release from the liver and even from the spleen. We can help it release some of the anesthesia that they've put into the client, and help the whole tissue soften, unwind, and relax so it doesn't hold on to that trauma. One of the things to keep remembering is, remember when your dog was 6 months old or a year old and how soft and pliable it was and how it could do anything. And then at 10 or 12 years of age, you can see your dog isn't very flexible and isn't very pliable. Well, it's holding on to all that trauma. So if we help that body release that trauma, it has much more fluidity.
So I'll just listen to
We can
my
hear you,
thing, yeah.
Kathy.
Turn down really low.
What's the question you want?
I want to ask about what she
Kathy,
does with
did you want to ask a
epileptic
question, or
dogs.
I'm going to mute you? Yeah, I see.
Who, me?
Kathy Davis, I see your
Yes.
hand up.
Okay. I did want a question on epileptic dogs. What kind of success have you had in helping to improve their disconnected rear end? The kind of epilepsy she has, and she's under medication, is hereditary. So,
Okay. You know, I've not ever seen an epileptic dog go from being epileptic to not being epileptic.
Oh, yeah, they
All right.
won't.
But the epilepsy, when they're in the middle of a seizure, it's very painful in an interesting way. It's exhausting.
Yeah.
Their body is throwing out all sorts of enzymes, and it slows them down. So by being able to get worked on their quality of health, we've seen some really nice changes. And
Okay.
it's something that you chase after. I have a couple epileptic dogs I work probably every 3 to 4 weeks. And we're watching the slow degradation where there was no drugs, then it was CBD oil, and now we're on to regular medication. But in between the seizures, the quality is really pretty decent. And we saw a difference by adding the massage therapy to it in Cranial.
Okay. I guess I'm going to have to get on your list and have you check her out.
You're on my list. No, that's
I know. I'm not sure which one.
Yeah.
Should I be worried?
We have a couple
Look, I
questions.
turned my phone around. You don't have to look at me anymore.
Right. We have a couple questions in the chat, but I wanted to ask Marcia, have you unmuted yourself to ask a question verbally? Marcia Bueller? Okay, maybe Marcia's unaware that she's muted. I'm going to mute her again. Okay, let me go back then to the couple of questions in the chat. Liz asks, what are some human clients come to you for?
Oh, the battery died on it.
Human clients come to me for everything from headaches to backaches to foot problems to hip issues to emotional issues. I mean, the range is pretty amazing. Some people want me to do craniosacral therapy. Some people want me to do a blend. Some people want me to do just traditional massage because they want to, you know, I've got somebody who's working on triathlete. And so he comes and gets work done to keep his body balanced for that. I also have cancer survivors who come to me because they have lymphatic drainage problems. They've had breast cancer. Their arms tend to swell up. Their bodies tend to keep fluid. And so we help the body decrease that also. Have had some male clients with testicular cancer, and we've done the same thing for that.
Yeah. I know Patrice. I was gonna have my dogs come.
Was someone asking a question? You broke up a little bit.
I think that was Marcia.
I thought so too. Let me unmute her and give her another shot here.
Oh, I was just gonna ask. I have a almost 14-year-old standard poodle. His arthritis is bothering him a lot. Is there? I thought about bringing him to you as well as one of my other dogs.
We've had very nice.
You do something to help with that?
We've had very nice success in just calming down the issues that irritate the arthritis. And yes, we've seen really nice issues with osteoarthritis in older dogs, and taking the stress off and helping them find a better balance and regain a little bit of muscle. Yes, I've seen real nice success in just managing it.
Okay. Thanks. Kathy asks, are there any generic stretches that you learn that would benefit my German Shepherd dogs or all dogs prior to entering the herding, obedience, rally, or agility ring?
Yes, there are quite a few, so that we can keep, and the simplest ones I can tell you is you want to go ahead and stretch the physical body of the dog. So I teach the figure 8, only instead of going around and around and around, I want the dog to wrap itself around one of my legs. So I'll gently hold on to its rear end and then draw it around my leg using a cookie. And then I'll do it the other side, so that you're getting a nose to tail stretch on the dog. So you're really, really opening up their rib cage on both sides. That's a tremendous stretch to do for dogs. Also, having them stand on their back legs, and you can hold their front legs no matter how big they are or small they are. You can still get a really nice belly stretch, and that's marvelous. And if your dog's in time, you can also do what we call the wheelbarrow, where you pick up their back legs and you stretch them up so that they learn how to get their spine to stretch. And those are things that you don't need anyone to teach you. You just need to practice yourself, and they're very safe. As far as individual legs, I won't talk about that. I'll show people and work with people, because I'm always very concerned about how you hold joints, and that scares me. I've seen people stretch their dog very incorrectly, putting pressure on knee joints or elbow joints, and I really rather show somebody than talk about it. I'm all about protecting your animals, even if we don't know what we're doing.
Great. Lisa wants to know if you make house calls, or do we come to you?
No, I do not make house calls. Everybody gets to come to me. And I have set up a very comfortable facility in my garage, because I have a almost 7-year-old mother, so we don't come into the house except for humans. But I have a nice setup for the dogs that's safe, and you can bring more than one dog, and I have a little yardish area that they can wander around in and be safe while we work on whoever's on the table. I have a number of clients who will bring me 3 or 4 dogs, and we work them one after the other, and you get to sit in a chair, you can bring something to drink, we keep the fans running, and we just try and make it a pleasant experience for everybody.
Great, thanks. Sue is asking for the 1-year-old golden, I think the hose jumper. In agility, when can they jump full height?
Well, that's a really good question. I was just reading about that on a couple of websites, and we really, if you're being smart about it, since they have a very shortened jump life, Chris Zink came up with a formula. You take the body weight and you divide it into the height of the dog, and that gives you a number, and the closer to 0 that number is, the longer your jump height. And once you start getting into the really tall dogs and they weigh a lot, you start noticing your number is 3 point or 4 point, and that means it's a much shorter jumping life. So the sooner you start teaching your dog to jump its full height, the sooner you're going to shorten its life, in my opinion. Your dog doesn't need to know how to jump 24 inches when it's 12 months old. It needs to know how to navigate a jump. It needs to know how to do everything safely. And usually between 15 to 18 months of age is about when people put the bigger dogs up to their full height, hopefully that the growth plates will be shut. I'm not a real big proponent of starting your dog at 15 months just because they let you. I think that we're pushing our dogs, and there's an extremely large number of broken dogs from agility that you start talking to people and you'll find out that their 8-year-old dog had to be retired and their 6-year-old dog broke, and and it's like, well, we're pushing them too hard. We're not treating them with the respect that they physically need. So I know they have a short career in agility, but I don't want to make it shorter by injuring them. So I subscribe to start a little slower, get the footwork down, and when you do put them at full jump height, they're going to be in such great shape it won't even be an issue.
Great, thanks. Liz is saying, what kind of issues in humans or animals respond the best to your treatments? Might be a long list, right?
Oh, yeah, it's a huge list. There is no such thing as what kinds. It's more a matter of finding out what doesn't, and everything. TMJ, headaches, eye problems, nervous tics, recovery from surgery, recovery from broken bones, tears. The list is sort of endless. And that's the wonderful thing about body work, is there's so much out there. And back in the day, before the AMA, before 1910, I think, which is when the AMA was really founded through grants by J.D. Rockefeller. If you go before that, massage has been around in China. That's still a major modality. Egypt, that was the healing modality. So it's something that's been around, and it's a complementary medicine. Okay, it's not instead of, but sometimes it's before. let's try some soft tissue and see how that works. And if that doesn't work, let's go to the doctor. Because I'm not a diagnostician, I am not a doctor, I am a body worker. And if I see that there's something going on that I don't like, I'm the first one to tell you, there's a growth here. We didn't have that growth last time. I'm not sure what this is. You need to go see your vet. You need to go see your doctor. That's part of what I believe my job is to help you, because you may not know what's going on in your lower back or the back of your thigh. And so that's part of what my job description is to assist you in finding the best health you can.
Thanks. Stephanie is giving you a shout out. You may not see it if you're not looking at the chat. She mentions that over the years that you've helped her and Michael and her mom with the Weimaraners, and that you've done incredible, amazing work. That's nice. And your property apparently is fantastic. So
it is. It's well worth coming just to be oohed and awed over. I live in one of the alternative universes. I'm off of Topanga Canyon Boulevard, up by the 118.
And the white peacocks.
Yes, we have peacocks and ridiculousness. It's a lovely area. We call it the alternative universe because nobody knows it's here.
Tracy England is also chiming in. Hi, Tracy, saying that you've been super supportive and helpful, and Zooey loves visiting for his treatments. I don't know whether you want to take this question off. Someone's asking how much for a half-hour session. I don't know if you want your rates, if you want to just have people contact you for that. Or?
Yes, please just have people contact me.
Okay, all right.
And let me phrase it this way. I'm very reasonable, and anybody who uses me will tell you that. I want to keep it at a point where most people can afford it, and not that it's like some insanely expensive thing that you can't do when you need to get it done. So I keep it at a reasonable cost.
Okay, great. Liz asked, can tinnitus be treated?
I have not had success, but I know of people who have. And here's something else that I'm going to tell you honestly. If it's something that is not in my bailiwick, that doesn't mean I don't know somebody in the field who it is. And I will refer out. Again, I don't think I'm the end all. I think I'm a good place to start. So if I know a therapist who's better at certain techniques than I am, and you need that, I will send you to that person. I will recommend that you go someone else. Not that I don't love you and wouldn't want you to be my client, but your health and your well-being is absolutely my first priority.
Right. And Patrice, do you want, Shrow's asking the best way to reach you? Do you want to?
My phone number is really the best. You can text or call. Texting is probably the best. I'm really bad about emails. I'm sorry. I'm not in front of a computer daily, so it's my slowest. So if you want to put my number down, I'll give you a couple seconds to breathe, and then I'll give it to you.
That would be great.
I'll even, here, wait, I'll write it down and put it on this piece of paper I wrote for all of you. So I'm doing that. I knew there was a reason I kept this pen out. So for all of you who are wondering, it's too funny. The institute I study with is the Upledger Institute, and that's the upledger.com. They're located in Florida, and we train ESSA, which is craniosacral therapy for small animals, and Dr. Sandy Howlett, Experience Equus, is my teacher and the lady that I highly recommend if you want information. She's in Ontario, Canada. And there you go, boys and girls. That's my texting. 818-701-6455.
That number again, 818-701.
701-6455.
Great, thank you.
I'm also on Facebook, so if I do respond within 24 to 48 hours is my normal response. Unless you say urgent, 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 it might take me a little bit to get back.
Okay, great.
And I don't work Saturdays. I work Sunday through Fridays for the most part. I never work Saturdays unless it's a serious, acute situation. I have to have one day for my family.
Diane is asking if you have any new protocols because of the coronavirus.
Yes, I am always masked, and I really do prefer my clients to be masked. And washing has always been a major thing. I wash up between every client. You know, it's a garage, so we have lots of air movement, so I'm not worried about stale air staying. And I wipe down things between all the animals, so we can just stay accessive. As far as my human protocol is concerned, I, again, am masked. Ask my clients, unless I'm working on them directly. There is some things that we do that's called mouth work, and that's actually putting my hands in, but I'm gloved. And we keep the house very clean. Sheets are changed, bottom sheets are changed, things are sprayed. I use essential oils to clean the air and kick up your immune system. So yeah, my protocols is as always reading the different recommendations so I can do whatever they are suggesting.
Great. We're coming up on the hour mark, but I'm sure we could take a few more minutes. Are there any last questions? I'll give people a second if they want to write something more in the chat or ask Patrice directly.
Hi,
Hi.
I came late, so I missed the first 20 minutes or so. Is there a paper, or can I recap, or did I just miss it? Just tell me.
Tracy, we have a
She recorded it.
What?
we
It's
recorded
been
it.
recorded.
Okay, great.
Yeah, so you can, but it's just me blah blahing, Tracy.
Yeah, but I wanted to hear the blah blah.
Okay.
You can play it over and over again. Yeah,
There you go.
we'll be sending out a link to the recording to all the attendees.
Okay, lovely. Thank you. That's what I needed. Thank you. All right.
Great. Any more questions? Nothing? Wait, oh, something. Oh, looks like just the thank yous maybe are coming in. Okay. Well, I'd like to thank you so much. This was informative and super interesting, and I'm sure everybody enjoyed it, and we get to watch it over and over and over. On the
Well,
recording.
thank you for the privilege of coming and talking to you. And if I can be of assistance, it would be my pleasure.
Great. Thanks so much.
Thank you very much.
Thank you, Mitch. Okay. Thank you. Thank you, everyone. See you at the next.
Bye, all.
Bye.
Bye. Close. Ciao, ciao. Ciao for now. All right. I'm gonna close her down.